Madam Chairwoman, and I'm certainly happy that I follow my good friend Thomas Massey because he set the stage for me perfectly. It seems to me that this hearing and yesterday's hearing are a little tone deaf. We have countless states that have shut down with businesses crumbling due to the overreactions of COVID-19. Yet we're here talking about how certain drugs need to have government-controlled prices. Yet there are millions who are thrust into that unemployment because of these harsh restrictions. And this hearing isn't even focused on the drugs or therapeutics that most people have in their mind, the vaccine to COVID-19. But since we're here, I plan to get a little substance out of this hearing. Today we have CEOs of some of the biggest pharmaceutical companies here with us. The way that my colleagues on the other side of the aisle view prescriptions, drugs, and price tags are very top line. They see a drug that helps people, but since it's not cheap, therefore we need the government to negotiate these prices. In typical fashion, you identify the problem properly, but butcher the solution with more government. Ronald Reagan once said, it isn't the government that's the solution, it's part of the problem. As a doctor in a past life, the first step when diagnosing an ailment is look to the source and keep it as simple as possible. If there's something preventive that can be done to stop the problem from occurring, why not try? Let's put this theory into practice. Why are drug prices so high? Many point to PBMs, greedy executives, a flawed patent system. Does anyone want to point a finger at the federal government? I know I do. In any prescription drug chain, you have health insurance, PBMs, drug makers, pharmaceutical wholesalers, pharmacies themselves. What do they all have in common? Government influence and control. Right off the bat, health insurance companies are exempt from antitrust laws. That means they literally do not have to compete. Many of my colleagues have been mentioning an infusion of competition to help lower prices. But how do you suppose we do this when a link in the chain can legally monopolize? I've been fighting my entire political career and before that to repeal this 75-year-old statute because you can't even imagine a world where health insurers have to compete for your businesses instead of leaving most Americans with little to no options. As for other entities involved in the drug process like PBMs, these companies became a main focus of Obamacare and actually fueled the creation of new rules by CMS under the Obama administration to come down on PBMs. And how about pharmacies and how they must deal with the 340B contracts that set strict price controls on various drugs? No market force there. And what about the drug makers we have here today? I'm sure they could go on all day about how the government is involved in their day-to-day business. Just the FDA regulations alone could keep you guys talking for days, but unfortunately, I only have so much time. My colleagues on the other side of the aisle want to point to our current system and say that this is the free market. Well, if this is the free market and this is competition, it is failing America. What we now have is nowhere near a free market. It's crony capitalism at best, and it's just the excuse my colleagues are using to push us closer to socialized medicine, where folks like these testifying today will be decimated, and those creative therapeutics for those that need it will be lost. So I say to you folks here today with us, join the side of simplifying the prescription drug process. Be for the side of free market competition, because soon you may look like those drug companies in other countries where your profits are capped. Your innovation is stifled, and your impact on making this world a better place will be completely evaporated. Now, lastly, hold your breath. I want to thank the majority for taking the first step in passing the Congressman DeFazio's and my bill, the Competitive Healthcare Insurance Reform Act, unanimously out of the House last week. This is the first step in which we get creating solutions where it's market-driven. Now let's get the Senate to pass it, and what we see is patients, doctors, and the system all benefiting. Thank you very much, Madam Chairwoman, and I yield back.